Over 14 million Californians use Medi-Cal, yet it continues to be underfunded. Is Prop 35 really the solution? Prop 35 on the California November ballot would make an existing tax on managed care organizations permanent and require the state to use most of the funds from this tax to increase payments to a group of Medi-Cal providers who are funding this ballot measure. This would make it harder for California lawmakers to respond to community healthcare needs year to year, like it already has done with the 2024-2025 state budget. In order to fully understand the impacts this ballot measure would have, we have to understand two key components: how the tax works and how the California state budget uses these funds. The way this tax works is it applies to MCOs who provide health insurance coverage at a fixed monthly cost, and the tax amount they pay is based on the number of monthly enrollees an MCO has. Medi-Cal health plans pay a higher rate at $274 per member compared to commercial health plans that pay $1.75 per member. Prop 36 would also cap the amount of tax that commercial plans pay at $2.75 per member. The state uses the tax money to match funds from the federal government that cover most of the Medi-Cal costs. So, where does the money from this tax go? The tax revenue was intended to go towards higher reimbursement rates for Medi-Cal health providers to help prevent provider shortages and long wait times for Medi-Cal patients. However, with a looming $56 billion two-year budget deficit, Governor Newsom committed less funding from the tax to cover Medi-Cal program costs, but did support payment increases to key healthcare providers under the 2024-2025 state budget, including community health workers, private duty nurses, adult and pediatric day centers, and children under 5 who are at risk of losing their coverage. However, if Prop 35 passes, these groups would lose this money from the MCO tax. Under Prop 35, the revenue from the tax would be required to go towards increasing reimbursement rate payments to only certain Medi-Cal healthcare providers. Here's a chart that shows which services would get rate increases from the MCO tax depending on whether Prop 35 passes or not. Prop 35 is not the end-all be-all for Medi-Cal funding. The MCO tax expires in 2026, which gives state leaders, healthcare providers, health advocates time to figure out a solution for long-term Medi-Cal funding. Prop 35 is supported by an array of healthcare stakeholders, including the California Hospital Association, California Medical Association, and Planned Parenthood affiliates of California, as well as the California Republican and Democratic parties. Prop 35 is opposed by many health equity advocates, including the California Pan-Ethnic Health Network, the California Alliance for Retired Americans, the Children's Partnership, and Courage California. To learn more about Prop 35 and get our voter recommendations, check out our guide, and make sure to check out our other videos to learn about the other 9 statewide ballot propositions on your ballot.